Hi there, my name is Reem Karmali. I'm an associate professor of medicine at Northwestern University and affiliated with the Robert H. Lurie Comprehensive Cancer Center in Chicago. I'm one of the lymphoma doctors at Northwestern, and I'm really happy to be presenting our data on the TRANSCEND FL study this year at SOHO. We're actually going to be presenting data on the MZL cohort for this study. So just as a brief background, marginal zone lymphoma is actually a difficult disease to treat in the relapse refractory setting because there are very limited options. And so this study looks at liso-cel, a 4-1BB CD19 autologous CAR in the relapse refractory MZL population. It included patients that had had 2 prior lines of systemic therapy, and the primary endpoint was overall response rate with a key secondary endpoint of CR. The way it went was that patients were enrolled and they were allowed to receive bridging therapy, but they had to have disease reconfirmed before moving on to lymphodepletion and then liso-cel. And so we found some really great responses. The overall response rate was 95% with a CR rate of 62%. The duration of response was quite promising at 88% at 2 years of follow-up. And we found that median progression-free and overall survival with 2 years of follow-up was actually not reached. And this was the case whether patients had a CR to liso-cel or a PR to liso-cel. And so we also found that the toxicity profile was actually very manageable. CRS occurred in about 3/4 of patients. Neurologic events occurred in about 1/3 of patients, but there were very low numbers of grade 3 events, and there were no grade 4 or 5 events. In fact, less than 5% of patients had CRS or neurologic events that were grade 3. And so I think what this underscores is that liso-cel is a reasonably safe product that provides great activity in patients with relapse refractory marginal zone lymphoma. And it really underscores its use as an agent in that setting. And I'm hoping that we'll get some really good news with the PDUFA date for this agent in December, that this will be a new option for us in the relapse refractory setting for MZL. Thank you.